We will now hear the presentation of ACT, Aging Communication Technologies. Please introduce yourself for the record, and you have 10 minutes for your presentation.
Thank you very much. My name is Kim Sawchuk. I'm the Director of Aging Communication Technologies, or ACT, a professor at Concordia University, and a proud grandmother. To my right is Constance Lafontaine, and she is the Associate Director of ACT at Concordia University. And on screen somewhere, there she is Dr. Catherine Middleton, an ACT researcher and professor from Ryerson University. So, I'd like to thank you for this wonderful opportunity to present at this really important hearing. We're from ACT, Aging Communication Technologies, a federally funded research project. For over 10 years, ACT has been examining the impacts of the transition to digital on the lives of those who are 65 and over, a cohort that is growing in this country, a cohort with a specific set of life conditions and thus concerns. We come to you not only as researchers, but as Canadians who sit on the boards of organizations that serve seniors living in conditions of socioeconomic vulnerability. Today, we draw on our most recent work, testimonies that are taken from individual interviews and focus groups conducted in 2019 with 62 older adults in Quebec, Ontario, Manitoba, and British Columbia.
Over the course of these hearings, there have been comments about this seniors market and its value. In one testimony by a service provider, low-income seniors were characterized as a niche. Being old and being poor is not a niche, it is a reality for thousands of Canadians. Estimates based on Statistics Canada data suggest that 14.2% of older adults are living under conditions of low income. If poverty were a virus, this would be considered a pandemic.
When, in 2008, we first started studying seniors and cells, the Canadian mobile market was just expanding. At this time, the high cost of access to services, roaming fees, and penalties were flagged by our interviewees as a significant impediment to their entry into this exciting new world. In the years that have ensued, concerns with the affordability of mobile devices and services has not changed. What has changed is this. 10 years ago, older adults reported using their cell phones for emergencies. Now, for those who can afford them, cell phones have become intertwined with all aspects of their lives.
Cell phones help seniors to counter isolation, connect to friends and family, or stay healthy. One Vancouverite recounted that when he turned 60, his doctor told him that now he needed a cell phone. Medical care, an issue of life and death, is increasingly predicated on a presumption of mobile access. We expect this trend to continue with the growth of 5G connected health monitoring services. Many seniors are caregivers for spouses or for children. These interviewees, mostly women, are unpaid for their caregiving work. For them, affordable services are a lifeline. We remind the Commission that telecommunications is not like any other sector because it is the infrastructure that increasingly enables all aspects of daily life tied to social inclusion, exclusion, isolation, and well-being.
In the notice of consultation for this proceeding, the Commission clearly signals the need, and I quote, to improve competition, reduce barriers to entry, and address any concerns about affordability and service adoption in the mobile wireless service market, end quote. The CRTC is entrusted with the responsibility, The CRTC is entrusted with the responsibility to ensure that all Canadians have access to mobile wireless services. Our interviewees concur with this position, your position, and that is why we are here today. We now want to share what those citizens, senior citizens, particularly those living on the edges of poverty, have to say to you, to all of us. Their words indicate the gravity of the current situation. And so we present now 3 realities that have emerged in interview.
The first reality is that low-income older adults are being priced out of the mobile market. We spoke to older adults who do not use cell phones, and we asked them why not. The common response was that mobile services are just too expensive. In one Montreal focus group, 2 women lamented that they would never be able to afford cell phones in their lifetime. As one stated, quote, "Cell phones belong to a different world than mine," end quote. Statistics gathered in Quebec in 2019 indicate that only 24% of seniors making less than $20,000 a year own a smartphone. This is in contrast to 65% of seniors earning over $100,000 a year. There's a clear link between affordability and access.
A second reality is this. Older adults are being forced into impossible financial life choices, including the need to cut down on food to pay a monthly phone bill, a recurrent tale. Another story. One 73-year-old man had to find a roommate after retirement to keep up payments for his mobile device. Some providers have argued that the ability of seniors to afford entry into the market for mobile services is not to their concern, that it is not up to the telecommunications companies to address poverty, that this is a social issue. This statement ignores the role that telecommunication companies are playing in the impoverishment of seniors. The current costs of owning a phone and accessing text, talk, and data, not to mention the punitive penalties for data overages, are making the lives of low-income older adults, in particular, more difficult. Access to communications and affordability is a social issue.
The third reality is that the so-called affordable services available to older adults are subpar and inadequate for their needs. One older gentleman from Montreal cannot afford to retire, and he's in between jobs. He needs to work, and he wants to volunteer. He can only afford a very basic $30 a month plan. The plan is inadequate, but he cannot afford more. He recently resigned from volunteering because it used too many of his 100 minutes. This is our loss as a society. He keeps conversations with friends short. He discourages people from calling him on his mobile phone so that he can guard some minutes in case of emergencies. He can't afford the internet at home, so he would like mobile data. He said, quote, "I would love to afford a better service, but it's not possible right now. It's ironic because if I had a decent phone plan, maybe I would be able to get more jobs and to earn more."
This experience indicates the inadequacy of current market offerings and its real-life consequences for many older Canadians who are struggling to stay connected, earn a living, or to contribute to society. Claims that services are now more affordable because the cost per gigabyte of data is declining, or because consumers are benefiting from gifts, from subsidies on expensive phones, from discounts for multiple users, from double data offers, or from free tablets, will not help these low-income seniors. They don't reduce the cost of the 100 monthly minutes this older man is purchasing or give him the better deal that he needs. Sure, advertised prices for wireless plans have dropped somewhat. It's not enough. Lowering prices that are too high in the first place does not create affordability. Despite lower advertised prices, Canadian households still pay more each year for their mobile phone services than in previous years. Some consumers may know they can switch providers or negotiate a deal. Telephone survey data that the Commission recently published indicates that those over 55 and those with annual incomes under $40,000 were least likely to switch. And many seniors do not trust the MNOs to do right by them. When older adults talk about the possibility of calling their service provider to get a better deal, they use terms like stress or nervous breakdown to characterize their experiences. Furthermore, as our research on abusive sales practices revealed, many older adults do not know that they can negotiate.
Even if people are able to get a better deal on their service, this does not make for a quote-unquote world-class level of service. The claim that a $30 entry-level plan offering 1 or 2 gigabytes of data is cheap is questionable when a $30 plan in Australia provides 30 gigabyte of data, unlimited talk and text, and international calls to 10 countries. In fact, the very concept of entry-level plans may exacerbate income-based digital divides. One segment of the population will be able to afford all of the services they need to engage in society or to connect to their health provider without worry. Meanwhile, the other segment, those who are already socially marginalized through poverty and who are more at risk of social isolation, will curb the use of their devices, diligently track minutes and data, and deal with the subpar 3G service that comes with today's entry-level plans. All the while, they may continue to live in fear of punitive overage fees and stressful encounters with the customer representatives putting them on hold for hours. So when we asked seniors about affordability, they again recounted disturbing experiences with sales practices in the industry. And to be clear, these questions weren't prompted. Their stories are similar to those we have heard before in our past research on aggressive and misleading sales practices. These practices are still pervasive, and they limit older adults' ability to access affordable services in Canada.
In conclusion, dear CRTC, dear commissioners, help. It's your job to regulate this industry that the telecommunication companies will have us believe is like any other industry. It is not the same. Purchasing mobile devices and services is not like buying a cup of coffee or a car, comparisons the operators have used. Telecommunications are fundamental to our ability to participate fully as members of society, and for seniors, they are ever more essential.
From the point of view of ACT, it is vital to understand that the market that has been discussed over the past months and weeks is not an abstraction. A market is comprised of consumers, living, breathing people in all of their diversity. Consumers are an essential component of any market, but consumers are not just economic actors making generic market transactions. They are citizens, they are grandmothers, grandfathers, great aunts and uncles, there are colleagues, our friends, and our neighbors. They all need access to affordable mobile wireless services to partake in all aspects of society now and into the future.
Dear CRTC, we are counting on you to do something. Thank you.
Thank you very much for your presentation. Commissioner Leisner.
Good morning. Thank you so much for your intervention and sharing the results of your research with us. I noted that you made some specific recommendations to the Commission, and I'm looking at paragraph 77 of your October 23rd, 2019 submission, where you talked about mandating lower cost full service plans. And I think you indicated the Commission has previously taken this approach with low cost data only plans, but our analysis points to the need for affordable plans that include voice calls, SMS, and data. The plans should be widely available, clearly promoted, and offer rollover data and voice minutes. I just wanted to ask you, in terms of these plans, and I'm looking at also CRTC Exhibit 3, which were a summary of the plans proposed by consumer groups. And I was wondering if you have a position with respect to price point, amount of data, some of the other components other than your general recommendation that it should be a full service plan.
Catherine, I'll pass this on to you.
Sure, thank you. So there's been a more detailed plan that was proposed by the Coalition for, I'm just getting their name right, the Coalition for Cheaper Wireless Services, the CCWS, that was presented to you earlier in the week. That's a plan that we support. So essentially the data that they're looking at, the pricing and so on, is in line with what we were thinking about. So we don't want to propose something different.
Okay. Thank you. Do you have a view as to whether plans like these should be prepaid or postpaid? I believe their suggestion was postpaid.
I think there should be flexibility. So there is certainly value in allowing consumers to determine which option they want. But the proposal to have postpaid, I think, is clearly defined there.
Thank you. I also noted that in your presentation today, before us just now at paragraph 17, you talked about the telephone survey data that the Commission recently published, which indicated that those over 55 and those with annual incomes under 40,000 were least likely to switch. Are you suggesting that they're least likely to switch not because they are satisfied with their plans, but because they find it too difficult to negotiate the web of alternative plans, negotiating with the telcos and all that sort of thing?
So I'll start and I'll let my colleagues complete. Just based on the interviews and our interactions with older adults, not only for this research that we've just completed, but also in the past as well, there are a number of reasons. First of all, there's a collective anxiety that we sense when we interview a lot of our interviewees about engaging with telecommunication service providers generally. One of them, this quote stays in my mind of, it's either you have money or you have patience. This kind of trade-off of like, you have to spend a lot of time when you're dealing with them. A lot of them have had very negative experiences with their MNOs, and therefore are reluctant to engage in a relationship, a new relationship with a different one. At the same time, concurrently, there's also a sense of loyalty in some ways. Again, somebody we spoke to was saying it's the devil you know. So you've been dealing with this company oftentimes for 40 years, and there's an expectation that you're going to be treated well because you've been a customer for so long. And so tied to that is a fear of switching and getting worse service, and connected to that as well is just a sense of like, I'll just do as well as I can in my current situation. Tied to that as well, we've noticed with the flanker brands that there's a sense of maybe distrust in some of these companies that they don't know too much about. When we ask them, do you know about these smaller names, sometimes they don't at all. They haven't heard about them. But other times there's a kind of sense that these high costs have been so ingrained, they've been so normalized that because it's going to be less expensive, it's going to be cheaper. It won't be as good. So there's a reluctance associated with the low cost as well.
And we had discussed with some previous interveners that appeared before us over the course of the last week and a half, whether this issue about reluctance to go to flanker brands had to do with the promotion and visibility of those plans. Is that something that you've looked at?
One other thing that's come out in the data and the interviews is the difficulty of understanding the plans, and also wondering, for how long will this be in place? Is this a promotion, and what kind of contract will I get? So I think, again, part of the confusion in the current market produces a kind of question about, well, here's a whole other set of information I'm now having to grapple with. I also think there are issues around kind of the visibility of those plans, and also wondering, well, who's regulating also whether or not the plans are living up to what they say they will. And also if they've undergone some kind of problem, there's a question of, will I get the same kind of service if I go with a kind of smaller flanker company?
And just to clarify, do you define flanker brands as those offerings of the three large MNOs, Rogers, Bell, and TELUS?
Yes, that's right.
Right. So when you've heard that seniors express a loyalty to a company that they have been using for a number of years, that they do not understand that it's still the same company that offers the flanker brands?
No, they do. No, most often, I don't remember an instance coming up in the data where somebody understood the connection between the flanker brands and the companies.
Okay.
Just a minute, Catherine, would you like to add anything?
I'll just add on that, because they don't understand that connection, in some instances, there are people who are concerned about going to a flanker because they think the network quality won't be very good. They don't understand it's the same network. So that's part of the issue.
Is there a specific measure you think the Commission ought to take to address this issue of lack of understanding? For instance, do you think it would be helpful if the Commission were to impose requirements related to the way these plans are displayed and customer service representatives being trained to tell people about the flanker brands?
I'll let Catherine answer this one.
Sure. I think any efforts that the Commission can take, whether it's through working with the carriers, with requiring them to provide information in different ways, these are some of the conversations that were had during the wireless code hearings. So one of the questions is, how should information be presented prior to consumers signing a contract? People, including myself, have argued that there should be much more upfront information in simple terms available before the contract point. I think the CRTC itself could have more information, more consumer-friendly information on its website. So I think there are certainly actions that can be taken. But I think in addition to that, it's not just the question of, I don't think it's the Commission's job to promote the flanker brands per se, and to promote I think it's the Commission's job to promote choice and to facilitate people understanding that there are different options in the market and facilitating their ability to change. And if I may, one of the other recommendations we made was to look at the approach that's being taken in the UK by Ofcom, where they're now, through their Fairness for Consumers, and I may be preempting one of your questions here, through their Fairness for Consumers initiative, their carriers are now required once a year to notify customers if they could get a better deal. So that's something that that's a regulation the CRTC could impose, and that, while it wouldn't force people to change, it would certainly help raise awareness of the alternatives that are out there.
And I see that that's your second recommendation at paragraph 77 of your October 23rd,
yes,
2019 submission. And you have a link there to the Ofcom requirements?
Yes.
Is that what that footnote 52 is?
Yes,
okay.
Yes, it is.
Okay. You also mentioned in your opening remarks just now, and I'm looking at paragraph 19, that when you asked seniors about affordability, they again recounted disturbing experiences with sales practices in the industry. So our decision on, or our report on misleading and aggressive sales practices was published in February of 2019. So do I take it that what you're talking about here is conversations you've had with seniors post the publication of that report?
Yes.
And do you see it as being a situation where these sales practices are continuing unabated? Have they improved slightly? Are they worse? Is that something you can speak to here?
Well, that was not the focus of our latest research, so
Understood.
That's why we said it came up unprompted. We weren't asking the question.
Okay, thank you. If I can refer you to Exhibit 2, the CRTC Exhibit 2, and these are low-cost plans currently offered by wireless service providers that are $15 and under and offer voice services. Arguably, they could be considered occasional use or emergency use plans. Other carriers have also, carriers have also appeared in front of us to say that, you know, this is an example. There's a multitude of low-cost and occasional use plans offered in the market. To what extent do you think the needs of consumers that you represent are being met by these types of offerings?
Well, there's also the issue that they don't necessarily know that these exist. So for a lot of people that we've spoken to, they're not necessarily on these plans. They're paying a lot more, like $30 for 100 minutes. And so this leads us to believe that they're not necessarily being offered the most suitable, the lower cost option when they do purchase their plan. So that is a significant issue related to Catherine's previous point, is that they're not aware of necessarily the most affordable option for their current needs and situation.
Another point here is that we see that these needs are changing and that more and more it's necessary that you have access to data and mobile data. So, and we also think that in terms of, the way that telehealth is beginning to work, and we've heard stories as well of older adults also needing being recommended by their doctor to kind of get a cell phone for emergencies, or having their pacemaker and information kind of connected to what's happening in their hospital or through their health provider, that this market is changing, and so the needs are going to change. So I think there's also a kind of fear, like, if I'm getting a $15 plan, like, is that still going to be meeting my needs because of the way that the world is changing around me?
Maybe just one more.
Can I jump in if you don't mind? So I think there are a couple of other points as well. So in response to your previous question, Vice Commissioner Leisner, this is an example of the kind of information the CRTC could make available. Technically you have, but certainly no consumer is going to find as an appendix to the hearing. The second point, though, is that I went looking for these prices this morning, and I couldn't find all of them. So the very first price, the $5 plan from Bell Mobility, the plan I could find was $7, not $5, which is 40% higher. And related to that is the literacy that you need to even figure out how you would get to these plans. So you go to the website and you're bombarded with the latest Samsung Galaxy iPhones. That is not a space for people with low income. So you have to drill down. You have to know that you look for plans. They may be bring your own device. That may not be a term that lower income consumers are familiar with. And then you have to know, even within that you're looking for a prepaid plan. So I think if you went back and talked to the seniors that we had spoken with, and we said, could you find these plans on websites? I think the answer would be no, or it would be after a great deal of frustration, a great deal of time and effort spent. So there's this disconnect between what the carriers say is available and what consumers actually have the capacity to easily locate, and then that they're aware that these things change. So the person that we gave an example of who has a $30 a month, 100-minute plan would probably be better off with some of the plans on this list. But what's the mechanism to help him understand that there are options out there that he could go looking for?
So it's a question of understanding the keywords and how many clicks you need to get down to the plan offerings.
Yeah, and then some of them aren't there, from what I could find.
That's also assuming you have access to the internet.
Correct. Did you have anything else to add?
I would just reiterate that these low-cost plans create a lot of fear in the use of the device and of the services. So we speak to a lot of people who are honestly stressed out about going over their minutes or going over their data, and it's resulting in them turning off their phones for long periods of time. So that's also something to consider when we're thinking about these low-cost options. Is this truly what people need?
Right.
Yeah, we would call this techno stress.
I think I saw in your intervention comments you received from seniors saying that they were asking people not to spend a long time with them on the phone because they were wanting to conserve their minutes in case of emergency. And I imagine there would be the same situation of turning off the phone so that you would have it available to turn on in case of emergency, and then you don't get calls from your family coming in. Right?
That's true, and it's also the case, though, that they also have the sense that I want to do more. You know, I want to have, you know, it's not just a question of basic affordability. I want to be a contributing member to society, and if you do want to be a contributing member to society, it means you have to be in what researchers would call position of perpetual access. So, and increasingly, there's the sense that there's a less and less of an option to sort of turn off.
In some of these plans that have a certain data allowance in a given month that's capped, do you have a view as to whether it would be preferable for, or whether the seniors that you talk to, whether they prefer that there be a charge for overage, or that there be an option of consuming additional data at a lower speed, or they wouldn't really understand the distinction? Do you have any comments to share on that?
We didn't ask specifically about the idea of lowering the speed, but certainly the idea of overages is, as I mentioned, something that they live in fear of. So this is certainly not the best option, we would say, for older adults. Reducing the speed and ensuring a continued access and not incredibly surprising bills at the end of the month would be much preferable. What we have to also understand is that with different levels of digital literacy, it means that it might be more likely that somebody forget to that they're not on their Wi-Fi network and that they're streaming something using their data. So it creates also a situation where they might be more at risk of overusing the data without necessarily knowing. So this is why the ability to reduce speed would be much better.
As well, I would ask the question, is this what we want? An extremely tiered, divided system where there's people who are really digital losers because they can't afford kind of 4 or 5G access. Will they have a choice in the future if certain kinds of services require you to have that kind of 5G access? What are we going to do in those situations? So again, that's one of the points we also made in our presentation today and have made in previous submissions, is we have to ask ourselves, you know, what kind of tiered service are we kind of expecting Canadians, not only as consumers, but citizens, to be think are adequate?
And if I could add to that, I think the other thing is that if there's a perception that so with the proposal by CCWS as an example, it says 4 gigabytes. So people would expect that after 4 gigabytes it would be finished. But there are other plans in the market that are marketed as unlimited. So people have an expectation, if they're thinking about looking for a plan that's fully going to meet their needs, that is actually unlimited for the vast majority of Canadians outside the environment of the CRTC. Unlimited really means unlimited. And so if there is an approach that allows the carriers to reduce the speeds, which we agree is preferable to the overage charges, it's still important that people understand that that's what happens, that they, and in the context of older people, they understand that their phone isn't broken because it's not working so well anymore. So that's something to consider as well.
And we all know the frustration of sitting there watching, waiting for a website to upload when you feel you may need that information immediately.
Right. There was some discussion between commissioners and interveners that appeared before us during this hearing about mandating a plan that would be low cost, that would have a means test of some sort. What are your thoughts on that?
We'll leave this one to Catherine.
Yeah, I don't think it's anything that we've really looked at in detail, so I don't think we have anything to add.
Okay. I don't want to push you on that point, but you've talked about seniors and perhaps the difficulties that they incur when they're trying to navigate online offerings and systems. And in the discussions we had about some sort of a means test, there was discussion about what kind of information would have to be produced, you know, an income tax return showing that your taxable income was at a particular level. Do you have any thoughts about how seniors would react to producing the information, whether it would be cumbersome for them to actually do the application process, recognizing that it's not something you looked into, but drawing on your knowledge of what you've heard from seniors in your research?
Well, I can speak as someone who works both with seniors and with people with disabilities, and quite often what the system does is put the onus on them to produce the evidence. And I think that this is, again, seems to be another instance of that, rather than guaranteeing also for all Canadians reasonable and fair prices.
Okay, thank you. We've talked in this hearing about whether MVNOs ought to be mandated. Do you see MVNOs as potentially serving niche markets for seniors? And if so, what kinds of differentiated services that seniors would be looking for that are not being provided by the existing carriers?
I can give a couple of examples. So one of the options would be different ways of pricing things. So maybe you don't have a monthly pricing plan. Maybe it's a weekly pricing plan that may work better for people on low incomes where the income is not distributed equally, or it may be that you're willing to pay more in a particular short-term period, not in a longer-term period. We may also see opportunities where you simply really pay as you go. So there was a bit of discussion of this in the previous intervention, where there is a reasonable price for data and you know what that is, and you just pay it. Now that wouldn't be suitable for everybody, but those kinds of options don't seem to be available. There would also be potential options where you might bundle in calling to particular communities, particular countries. That may be that's something that we often see in MVNO offers in other countries. You might look at, I think one of the things that could provide value is that our research shows that many seniors are holding on to their landlines. And so they're paying for mobile and for landline. And so while there are certainly some affordances that they like with the landline, you can have several people on the call in a way that's easier than to do that on a mobile phone. It means that seniors pay a lot for long distance calls. So I think there would be ways that somebody could come in with an offer that would really help people better use their mobile phones that they're already paying for to connect with friends and family on a long distance basis. So I think given the opportunity to look at different ways to package services, there may be quite a few options that companies could come up with.
One thing I also want to say, we talk about seniors, and we can mean sometimes 60 plus, 65 plus, but also we know that sometimes there's a distinction when you hit 74 and you're in your 80s. So again, I think having plans that also offer options to meet the kind of changing needs as people age is also important to kind of consider.
Yes, I think I saw in your research that only 43% of seniors over the age of 75 use the internet daily or weekly, but the number is much higher for seniors that are over 60. You've expressed some concerns with respect to the transition from 4G to 5G and the impact this may have on seniors, particularly with respect to device compatibility. I think I saw in your intervention that seniors had mentioned how much they like flip phones. My mom loves her flip phone. What, in your opinion, could be done by the Commission to ensure that a transition from 4G to 5G goes smoothly and doesn't leave them behind?
Well, key to that would be to not create a situation where they need to absolutely get a new device. There's that reality, the one of flip phones. So for instance, we encountered people who got smartphones and then would never plug them in, didn't charge them, didn't really like using them, and then reverted to a flip phone and then were able to connect. So one of the questions is, are the service providers going to support flip phones going forward to allow people to acquire new flip phone devices or also use existing devices? Another very important reality is that a lot of the older adults we speak to get their devices secondhand, so usually passed down from their children. So this has a number of implications. First of all, it means that the people who do have children who are already less at risk for social isolation already have a heads up or a leg up on the others and usually have access to a better device. But it also means that for these seniors, they want to be able to use not necessarily the latest device out there. They want to be able to use something for a longer period of time. So when we go from 4G to 5G, it's important to make sure that the 4G connectivity endures for a significant amount of time. And then there are also questions about how does the transition to 5G give a license to really significantly increase the prices for services?
And one other point I might add is that in thinking about what MVNOs could offer or other companies in the market, if you're looking at increasing competition, I think as we move into 5G, we're going to see a real variety in services. So we really do very much have one-size-fits-all pricing plans now. The plans are pretty similar across the carriers. They're all talk, text, and data at the higher end. They've got the mixed lower end. As we move into 5G, you're going to see various IoT things. You're going to see a use for healthcare. You're going to see smart cars. You're going to see all kinds of things. And it's likely that what a senior wants, or even a low income versus a high income senior at a different stage in their life is going to be quite different from somebody who's working full time, somebody who's managing a young family. So I think one of the things that one of the fundamental things to look at is ensuring that there is more choice in the market, and that will allow innovative companies to come in and offer more selective, more targeted plans.
And my last question relates to something I noted in your intervention where you talked about administrative fees being a burden on seniors. So I gather that has to do with things like seniors calling a customer service for help rather than doing something online. In your experience, is it their preference to make these calls to customer service as opposed to trying to figure out change plans, whatever, online?
Yes, absolutely. So they typically call or they even go in person, and those are two by far preferred ways of engaging with their service providers. We spoke to very few people who said that they went online for these services. So this also heightens the kind of like interpersonal relationship that one has with their service providers, and it, on one hand, gives more opportunities for overselling or upselling through those contacts, but they also rely on those relationships to get information, to purchase their plans, to, if they're switching providers, to switch providers. And then connected to that as well is they very much emphasize the importance of having bills, of having access to their monthly billing on paper, and this allows them to better understand what they're being charged for, and it reminds them to look at their bills. And this is something that they were quite adamant that they wanted and that they very much appreciated.
It also helps them to be able to take the bill and physically to show it to someone else, to be able to go over it and get information about what's happening.
And so is this a question of being charged for the bill or not even being able to get the bill on paper?
We had some instances where they were switched to an online bill without being advised that they were, so them all of a sudden starting to not get their bills, and that causing issues. And we also know there have been issues in the past with MNOs wanting to charge for issuing paper bills. So that would be the other ones. So it's both a question of not paying for their own bills, but also of being able to have access to them in an easy way and in a continuous way.
Were there any other administrative fees of concern that were raised?
None come to mind. Not from the interviews.
Well, thank you very much. Those are all my questions, Mr. Chairman.
Thank you. Commissioner McDonald.
Good afternoon. I wanted to just jump back quickly to one of your earlier statements, and your studies may not have looked at this, but you were talking about the hesitation that many low-income Canadians have with respect to interfacing with wireless service providers via their website. And I know there's also issues whether they have access to the website. But there is a certain amount of complexity in the wireless industry, given the number of phones, number of plans, number of different providers, number of different brands, and so forth. So I would liken the wireless industry to other complex organizations and industries such as banking or access to government services. And I'm wondering, can you give us an idea whether low-income Canadians are more hesitant to deal online with their wireless service providers than perhaps they would be accessing online banking or accessing government services? There may be other examples as well.
They have issues with all three, to be quite frank, and we have heard stories about, the transition to online banking and the problems that may produce. Issues and concerns about privacy as well come up in those conversations. So yes, these are incredibly complex industries, but you cannot not have a bank account. You cannot not have a cell phone. So that's what makes it's a complex industry, but it's not an optional industry to live right now. So yes, these things definitely come up.
Yeah, and we've thought about this in the past in the sense of, like, on one hand, it's a forced digitization of older adults. So they're forced to increasingly go online for services that are essential. But then the flip side of that is also forced exclusion. So the people who are not, going to spend a lot of time in front of the computer to try to figure this out, what is the cost of that? And you mentioned as well the kind of online government services. I would just point out that for the consultation on misleading and aggressive practices, we worked with older adults and we suggested that they should go on the website of the CRTC to file their own comments. And we spent a long time with them. We actually filmed some of them interfacing with the CRTC's website. One of them never ended up submitting a comment. Others ended up submitting comments after about 40 minutes, an hour of navigating the website, and that was with some help. So I think that this is an important challenge, but as society is becoming increasingly digital, it is up to industries and governments to understand that there is digital diversity in Canada and to put in place inclusive structures.
Yes, and I also add that I don't think we should accept as a absolutely set in stone reality that these services have to be complicated. So they certainly are complicated now, but you look to other markets, and again, this would be a place where you could see new entrants or new mobile MVNOs coming in and having offers that were much, much simpler. You can see providers in other markets that sell their services as small, medium, large. End of story, no promotional pricing. That's what you want. You pick one. It's quite simple. So I think it's important to resist the assumption that these services must be complicated in perpetuity.
Thank you for those additional comments. That was my only question.
Thank you very much. Thank you for sharing your research and submissions with us.